Francis welcomes a new device that helps people who struggle with heart problems or have had a stroke. The best part, it requires no open heart surgery and is completely safe to use. Fox 14's Hunter Elise is back from St. Francis with the breakdown on the device. Hunter?
Sarah, the Watchman device is brand new for Northeast Louisiana, and St. Francis is excited about the new procedure. It gives patients in our area a chance to be exposed to modern technology without driving to Shreveport or Baton Rouge. According to the American Heart Association, more than 2.7 million people are known to have atrial fibrillation, a condition where an irregular heartbeat can lead to blood clots or strokes. To treat AFib, doctors usually prescribe blood thinners. However, for some patients, the thinners may not be enough.
Now we have an option, which is this new procedure, fairly new procedure in the United States, new here, obviously, in town, which is called Watchman device.
Getting the Watchman device implanted eliminates the need for open heart surgery.
We put a small catheter in the groin, patient's groin, and when the catheter goes all the way to the heart, goes to the left side, deploys the device, which looks like a small umbrella, and opens in the appendage.
The Watchman device stops the blood from entering the heart and reduces the patient's risk of the blood getting to the brain and causing a stroke. Recovery time is also reduced, and patients can return home within a week.
And the procedure itself takes less than 2 hours to do it from beginning to end. And once it's deployed, the patients go home, and in 45 days we recheck the device, and if everything is okay, they can stop taking the blood thinners, and they will be protected against the strokes.
Once the procedure happens, the device stays in the patient's heart forever. St. Francis also says 99% of people who have the Watchman implanted are able to stop using blood thinners within a year or less. In the studio, Hunter Elise, Fox 14 News.